I'm Dr. Kavitha Lakshmi Easwaran, a senior obstetrician and gynaecologist, Speciality Center, Kasturinagar, and Cloud9 Hospitals, HRBR. I'm proud to be a part of digital wellness for Bits and Bytes program on women and women's problems. And womanhood is such a divine thing that God has given mankind, and to be a woman is the biggest blessing and the gift that God has given to the world. Now today's topic is on PCOS, which is Polycystic Ovarian Syndrome. Earlier it used to be called PCOD, which is Polycystic Ovarian Disease. Now there are a lot of misconceptions and other viewpoints on PCOS, but to put it in a very simple manner, I would say it is basically a genetic disorder which is inherited, and when you know it is inherited and genetic, it runs through the genes in several generations. Now this was never there maybe a century back because of the lifestyles that Indians led, but PCO has slowly transferred from the Westerners to India because of the westernization into our country. Now when I say westernization, we have definitely inculcated a lot of good things, but along with that we have also got gifts like PCOS. So what is the basic thing in PCOS is that there is an insulin resistant gene somewhere, where you have inherited either from the maternal, mostly from the maternal side and less from the paternal side. So usually it runs in families where there is an insulin resistance which causes excess of metabolism towards excess of glucose and other things. And when you have a resistant insulin running in your body, you tend to have because insulin has a growth like factor effect, it tends to cause obesity and excessive growth in the lady. So it starts from there, and because of insulin resistance, there is a tendency for gaining weight, and all these syndromes are also associated with defects in ovulation. Now all the hormones play a role starting from the hypothalamus, pituitary and ovary in a lady when it comes to that, and all this causes an excess of estrogen because there is a defective or an erratic ovulation which happens in PCOS. So what happens is there is an excess of estrogen, and estrogen has its own side effects in terms of increasing the inner lining of the uterus, delaying your period, and when the period happens there is an irregular sloughing of the period, so there is a decrease in the flow in the period, or because of excess estrogen there is more of worsening of obesity because it is more of an hormone which tends to bring in a lot of unwanted metabolism in the body. Say once in 3 months. Why wouldn't we? Why should we have a period every month and go through the pain? So it is very important that a lady should withdraw at least once in 35 to 40 days. Otherwise, the cumulative effect of estrogen can cause an early onset of diabetes, can cause an early onset of hypertension, hyperlipidemias, and ischemic heart disease, basically. And other than that, they can also be prone for endometrial cancers and breast cancers because they are again estrogen dependent tumors. So it's very, very important to diagnose PCOS, to treat it appropriately, and to find the other coexisting medical disorders like hypothyroidism or obesity or any other problem that can be. Since there is a vicious cycle of, say, obesity, sometimes not there, with an hormonal imbalance of estrogen, lack of progesterone, and an excess of estrogen, an excess of growth hormone like effect because of a resistant insulin. And this vicious cycle continues unless it's broken at different levels by different ways of treatment. So holistic approach to this would be to follow a healthy lifestyle again, because that is the only thing we can do to stall this disease from the beginning. Like I said before, it is a genetic disorder. So we cannot change anybody's genes. Neither can we change the effects of the genes. But then we can modulate the effects of these genes by following a healthy lifestyle and make these genes start acting at a later age and not give it more chance to act at a younger age. For the first 2 years after menarche, generally children have periods which are irregular. So PCOS sets in after about 2 years of menarche, and it can continue throughout the reproductive age group. So right from childhood to adolescent period to the reproductive age group and following that as well, the bottom line is to follow a healthy lifestyle. Do yoga, do pranayama, we go back to our Indianism, follow a healthy, balanced Indian diet. Why I would say Indian diet is most of these fast foods which serve all these pizzas, burger, coke and those kind of stuff they add food additives which can be harmful to your ovaries, that can be harmful to your hormone systems, that can be bad for your heart and for your other metabolic functions and other organs in the body. So go back to our balanced Indian diet. You take any Indian diet, it will be a highly balanced diet. You take idli, dosa, sambar, it will have the right proportions of carbohydrate, protein and fats. You take roti, chawal, dal, sabji, again that would amount to be a balanced diet. So bottom line would be to follow a healthy lifestyle, to follow healthy eating habits. When it comes to healthy lifestyle, avoid smoking, avoid alcohol if you are already indulging into it, because that can again worsen your hormones, especially alcohol, because it's metabolized in the liver, and these hormones are also metabolized in the liver, so it tends to affect its metabolism and then again create problems like worsening of PCOS. Exercise is very, very important to keep your weight under control, to keep your metabolism right. It is very important to have good cardio exercises at least 3 days a week, either in terms of walking or gymming or whatever I would say is possible within the limits that you are living in. So if you do all this, we can modulate the effects of PCOS naturally. Now when it comes to treatment, earlier we used to say give ossipils, give withdrawals and all that. I would say better is to go into a healthy lifestyle approach of healthy diet and exercise, and then give regular withdrawals so that the period doesn't delay too much and the cumulative effect of these hormones don't cause an early onset. Short-term therapies with myoinositol or metformin or other drugs are has to be modulated. Any concurrent metabolic or hormonal imbalances have to be treated, and when you have a period which is more than 35 to 40 days, please see your gynecologist and take advice and make sure you have your period on time, because this has a long-term effect on, later on effect on infertility as well. It can cause subfertility because again ovulation is a problem there. So before you plan for pregnancy, PCOS has to be corrected. When you are a PCO, your treatment for subfertility is a little different from when you are planning for a conception naturally, because your ovulation has to be timed. So be proud to be a woman. Make sure you take care of your health. For any problem, I would say a healthy lifestyle and a healthy diet is very important, and that holds very true for PCOS. And take care of your health. Avoid addictions. Avoid indulgence in junk food, and have a very positive frame of mind so that PCO doesn't take over you and you can take over PCOS. Thank you so much for watching Bits and Bytes, and I would be continuing other series. Watch out for the next Bits and Bytes on fibroid uterus.